Welcome to the Friendly Moms Club podcast with Jen and Karlee. We're the new mom friends you didn't know you needed.
We are creating a safe space to bring moms together, lighten the heaviness, and find joy in the everyday moments. Together we will share our own experiences of being new moms while navigating the topics we wish more people talked about.
Join us every Monday to hear us skip the small talk and dive right into the uncomfortable.
Happy Mom Day, Karlee.
Happy Mom Day, Jen. It is actually a beautiful day today.
I know, and it's a shame because
hearts.
In order to record, we've had to shut all the blinds and the curtains, and it's actually so nice and sunny. You and Henry just went for a walk, right? Was it really nice out?
Yeah, a rage walk. It was nice out. That is not why we went for a walk. We went for a walk because he was raging. So we were going to have lunch at home, and then I was like, I can't do this. So I threw some noodles and some green beans with some Parmesan and butter in a container, and we went out the door. And I was going to actually get lunch at the little market by us. Mm-hmm. But then I got there and I was like, I'm not even hungry. So then I just fed Henry his noodles in the high chair they have there. So I hope they did not mind. But I did buy groceries, so I feel like...
You still bought something from them.
Yes.
So I feel like that's what matters.
And I'm a regular, so VIP if you ask me. Yeah.
I have this question that I've been wanting to ask you because we talk about it in one of our episodes about relationship and how to get things going. And remember how you did the cold plunge last year and it got things going. Well, you did the cold plunge again this year for New Year's Day. So listeners got to know, did it work again? Is it like a 2 for 2 thing? Oh,
it was just luck that first time.
Okay, so we shouldn't advise everyone to go do a cold plunge.
Well, I mean, I felt great after. More of it was that last time we came home, had a nap, so then we were all cuddly. But this time, I'm like, I'm too busy to have a nap. So I'm pretty sure I was editing the podcast or something.
Is this toddler lifestyle?
Yeah,
your toddler's just so busy. It's so different, right? It was baby life was last time. Now your toddler life.
Definitely. Okay. There was no time for that this time. Yeah,
we just needed to know. So
nope, did not get to practice our baby making.
Yeah,
one day.
Part of the other reason toddler life is so busy is because they are always sick. And we have experienced, I don't know, a month-long sickness. Both of Henry and Jordan have just been sick a lot. Mm-hmm. So we thought we would come on here and talk about all of the different kind of illnesses, medical conditions, skin conditions, things we've experienced in the past 15-ish months of their life. And let me tell you, there's a lot. There's a lot of things that can happen to these little babies. And most of them are super common. Nothing to be worried about. However, you are going to worry. And I've spiraled many times in the past few weeks that Karlee has had to calm me down from. So I haven't even gotten better. Maybe a little bit sometimes about some things. They're so small.
How do you not spiral though?
They can't tell you what's wrong. You don't actually know. You're just trusting that things are going to get better. And it's so heartbreaking when you see them sick.
Definitely. And like I said today when we were texting, that we're biologically wired to stress and to also go to the worst case scenario. Our protective brain comes out and automatically assume the worst. But Dr. Google does not help. So you stay away from him.
I know.
Yeah. He's definitely a middle-aged white man who is mansplaining things to us that we don't need to be mansplained about.
That is true.
It's my hot tip of the day. Stay away from
Don't Google
Dr.
everything. So anyway, we're going to go through some of the stuff that we experienced with our little ones from when they were born to up to now. We'll kind of go through what they got, what different illnesses we saw and skin conditions, things like that, what they looked like, what helped. And then we're just going to go through good tips and tricks and things to have on hand at home for when your kids get sick and what to do and what resources to look for and things like that.
Before we jump into that, I just want to say also that for some babies, teething can actually be just as bad as an illness. So for both of us, our kids, one, they're early teethers. They already have 7,000 teeth. And then on top of that, it's very hard on them. I don't want to say they don't handle it well because how could you? It's more it really affects them. Our whole world is thrown upside down when they teeth. And it's the same as when they get sick. So we're not going to really go into that, but just note that every time there's any kind of symptom, fevers, drooling, irritability, it's always are they teething or are they sick or is it both? And you know what? Sometimes it is both.
And sometimes you don't know because it takes a couple days and then you're oh, there's a tooth that makes sense. Then you kind of hindsight or that makes sense now why he's, hasn't been feeling well. But teething totally counts under this list to me because it's bad.
It's bad. It's like debilitating. It's like might as well have
like not
hand,
sleeping
foot,
in the
disease.
night, screaming, not wanting to play, clinging to you, needing you all the time. Like it is just the same as them getting a cold. It really is. So that is a very good point. Teething is not to be taken lightly. Like for some babies won't experience anything, but some babies will, and it'll be like an actual sickness.
And if your baby's one of those babies that's not affected by it, you don't need to tell us. Yeah. We don't need to know.
Don't advertise it because...
Yeah. You don't need to tell us, oh, my baby, we barely even, you can say it in like an empathetic way. Like, oh yeah, like we didn't experience that, but like, wow, it must be so hard. That's fine. But if you're like, oh yeah, like, my baby's so tough.
Yeah. They got teeth and we didn't even notice. Oh, yeah. I just don't have anything to say back to it. So let's go on to the first kind of big one, normal one that everyone probably wants to talk about is getting a cold. Jordan got COVID and the rhinovirus, but then also just got normal colds as well. I don't know.
Rhinovirus is the common cold. And then there's also things like coronavirus and RSV. And those are all like upper, and influenza. Those are all upper respiratory infections that all have very similar symptoms. Obviously, COVID has additional ones.
Jordan had the one with her lungs and breathing, and it's very common in young babies. Bronchiolitis. Bronchiolitis.
Oh, bronchiolitis, yeah.
It's like a step less than bronchitis, right? Like it's less serious than bronchitis. Yeah, yeah.
I'm just going to nurse-splain one thing here real quick to make this make sense. So when you get sick, there's a virus or a bacteria, or it could be other things too, a fungus or what are those other little guys? Parasite. Like there's lots of different things that can, like pathogens that can make you sick. The most common are viruses and bacteria. So the difference between those is that viruses they go away on their own, and bacteria typically need antibiotics. So that's why antibiotics don't work for viral infections. And then on top of that, you can have a viral infection, say rhinovirus, that affects your upper respiratory system. So like I said, upper respiratory common, rhinovirus, RSV, coronavirus, and influenza. Those are like the most common ones that you can get. And they affect your upper airway. So your nose, your throat. And then that can then lead to further things like bronchitis. Anytime there's itis, it means inflammation. So bronchitis is inflammation of the bronchi, or bronchiolitis, like you said, that's inflammation of the bronchioles. And that's just inflammation. You can also get a bacterial infection from a viral infection, in the way that you can have an upper airway viral infection that can then lead to a bacterial infection like pneumonia. Does that make sense?
Yep.
And then my other thing I'm going to say before I go back into mom mode, there's also like the 24-hour tummy bug, or something like norovirus, like what we call, like lay terms, we call in air quotes, the flu. Right? Like a tummy bug.
Yeah.
But really, the flu is influenza, which is an airway infection, an upper airway infection. So like in lay terms, we call like the tummy bug the flu, but really the flu is influenza. It's like my like pet peeve when people say, oh, you have the flu and it's their stomach. I'm like, no, you don't. But I get it because I also say it too.
Us non-medically trained persons.
It's confusing, but that's that.
Okay.
So back to the common cold, but we could also just loop all of those four that I said: rhinovirus, RSV, COVID, all upper airway infections.
Definitely.
Let's go there.
Because they are very common.
You don't always know which virus it is. And really, it doesn't matter unless there's complications. Like everybody got really into testing for COVID for a long time. But yeah, so if your kid has one of these, it doesn't always matter. It can. We won't get into that though.
Yeah. But I think the only reason we found out it was COVID and the rhinovirus is because she was less than 3 months old. And when babies are less than 3 months old and they get fevers, you're basically going to have to go to the hospital. Like most times, if they're under 3 months old, their immune system is just so underdeveloped. There's just extra precautions that they take, and that's why they did testing. So she actually had to get blood drawn, and it was terrible. And they did a little catheter to take a urine sample because if you think, how do you do a urine sample for a baby? They can't just pee in a cup for you like we do. So they have to like put a catheter in and get some pee out. It was not fun for her. But that's why we actually know what she had. We only know these things because she was less than 3 months.
And also, like, if you're seeking medical care, they want to know what it is.
But if you're older, like we've gone recently for stuff, and other than like they look in her ears and ear infections, but really for the cold stuff, they just say, nope, your breathing's okay, like oxygen levels are okay, listen to your lungs. If you don't need help with breathing, they normally just say like, wait it out, use Advil, Tylenol, whatever. They won't normally do testing now for like the older kids. I think it's just the younger kids that they might want to do some extra tests on.
For sure. And I think under 3 months that there's also concerns it could be something more serious like meningitis. There could be other things. So we were told if your child under 3 months ever has any kind of fever or like diarrhea, that you just automatically either go to the doctor or the hospital.
Yes, that is what they have told us, what we've heard, and that's what we've kind of done. My child has been sick a lot recently, and I've been reading a lot of medical stuff. So we're kind of like going on a tangent here from what we were going to talk about, but
tangented.
It's interesting stuff. I think it's interesting.
Definitely.
But there's an article, and I will link it here, and she is a doctor from the Mayo Clinics, and she's a pediatric infectious disease doctor. And she says that it varies, but some babies and toddlers can get as many as 12 colds a year, which is just insane. She said it's more on average between 7 and 8, but it's higher as they start daycare and preschool. It can go up to 12, which is just literally mind-boggling. There's 12 months.
Like
so it's just nonstop.
Every month.
You get like 1 week off a month that they're healthy and happy. And then you just, so she says that could be a normal immune system because people start worrying like me that do they have a bad immune system if they get sick all the time? Like, oh no, she's been sick 4 times. Does that mean she has a weakened immune system? Or does she have some other more serious condition that makes her have a weakened immune system, right? Like a lot of parents will spiral like I have. And so she was here to say like, look, like this is actually quite common. They can get up to 12 and we would still consider them to have a normal, good immune system.
Especially like they get sick and then they miss a week of daycare and they're miserable for a week and then they finally feel better and then they go back and then they have a good week, like you say, and then they get sick again.
Yeah, it can be nonstop and it's exhausting and it's going to be scary, especially the first few times they get sick. It's just not fun. Extra scary the first few times.
Definitely.
But this doctor does go on to say, and I think it's worth noting, that there is like scientific evidence that breastfeeding can help reduce that frequency. And that's because they have antibodies from the mom that get passed through in the breast milk. So it can help. We did basically formula only from a couple months on. But when Jordan was getting sick, Karlee and another mom friend donated their breast milk and some colostrum they had to me. And we were using that to like just help her kind of get through the colds. And I do think it helps. We weren't breastfeeding, but I had some very nice friends that helped and tried to help Jordan get better by giving us their breast milk and colostrum. So just an interesting tidbit. Could look for some donated milk, and there's lots of options out there. So just another option.
And also no shame and no guilt if you were either unable to or didn't want to breastfeed.
Yeah.
If your kid's getting sick, like it's very easy to go into like the blaming and shame spiral that it's your fault. Sure, it's beneficial, but like you're not causing your child to be sick if you're not breastfeeding. Just want to say that.
And I would go out to say that I probably wouldn't have outsourced breast milk. Like I probably wouldn't have tried hard to find it. It was just that you guys had some available and had this extra storage and basically just offered it to me. So I said yes. But that wasn't anything I thought of. It wasn't something I would have like probably pushed for, but I do think it was helpful.
It helps that we know each other.
When you're sick.
Yeah, you need anything.
But when you're sick and your kid's sick, it can be hard to do more. Like that might seem like just too much on your plate to go try to find some or go on Facebook and join a group and ask. Like sometimes that's just too much, right? Mom friends.
It was there.
For the win.
It was splashing in front of you. And then, let's touch on this too. If you can breastfeed while you're sick, there's no reason that you can't. There's a very few small caveats. One of them being if you have HIV and you're not on antivirals or your viral load isn't suppressed to a certain amount, that can be a contraindication. Hepatitis B and C can be an contraindication. There's very few. So like if you have the common cold, you can breastfeed. It's actually good for baby because baby's getting your antibodies if you're sick. And likely like they've already been exposed. They've been around you. So do good hand hygiene, wash your hands, don't cough on them, cough away, wear a mask if that makes you more comfortable. You can still breastfeed if you have like a respiratory infection.
I don't even know how many colds that we've experienced.
So many. I have one right now.
I don't even know. Like
this morning out of nowhere.
We both noticed that we both got sick more often after pregnancy too, which was interesting. That I didn't think my immunity would change at all, but I don't know if it's just being around more babies too. I don't know.
More people.
Do you find as a mom you were also getting sick? I don't know.
When you're pregnant, your body your immune system does lower.
But doesn't it come back up in postpartum?
the baby's out, and that was the reason of the lowering. But then also you've gone through a big stressor, you're not sleeping, and then you're also exposed more. So I don't actually know about any of the research postpartum, but like you're stressed and not sleeping. So why wouldn't you get sick more? Physiologically, in pregnancy, you're more likely to get sick. I went through nursing school and I only got sick one time, like actually one time. That was 4 years, or no, 3 years, I guess, 3.5, only once. And then the first like 3 months postpartum, I had like 17 colds. So if you're getting sick, you're not alone.
It sucks extra because then your child is sick and you're sick. And being a mom doesn't stop when you're sick. Like you still have to do all the same things, even if you are hacking up a lung and feeling gross and coughing and sneezing. You don't just get to lay and rest in bed anymore like you might have done before kids, right? It's a challenge. And if your kid is sick, well, you're like, it's just a common cold or any of these things we talked about are actually very stressful, and they can be a lot of work and exhausting, mentally and physically draining. And it's common, but it sucks. Don't let anyone tell you like, oh, it's just a cold. At least they just have a cold. Like it is still hard.
And it sucks if you're sick at the same time as them. And it also sucks if you're sick or they're sick and then they get better and then you get sick. Like they all suck.
Then it's literally a never ending.
There's no winning in motherhood. Let me tell you.
So the next one that Jordan experienced a lot of, and Henry's also had, are ear infections.
He hasn't actually had any yet.
I thought that was what it was. It was strep throat and...
Well, his ears were inflamed, but they weren't sure if it was for sure an ear infection.
Okay, so it was a possible ear infection.
You're right.
Possible strep throat.
It wasn't strep throat because they ended up doing the...
Oh, yeah. I don't think I ever knew if they got the results. Okay. So he had a possible ear infection.
And I had lots when I was a child.
Well, Jordan's had like...
She's had like enough for both of them.
I think she's had at least 5.
Yeah, that's a lot.
5 rounds of antibiotics, which is here nor there. We're not going to get into if you should take them or not. Sometimes they're needed. Sometimes they're not. Some people have personal preference on whether or not it's needed or not. We've always just been told it was never an option. It was, here's antibiotics. She needs antibiotics.
It's likely based on what it looked like.
We can sometimes see red on the outside of the ear, but you can't see into it.
But when they look in with their little...
You should see Karlee's face right now. It looks real cool, people. But yes, I know exactly. There's like a certain way you're supposed to hold your child to do this. And like Jordan's just so used to it now. She just like sits on my husband's lap and like turns her head, and it's quite funny. They can be very common, and it has to do with, we're not going to get into all the science, but their ear canals being small and there's not a tilt that adults have, and that can just lead to an infection more easily. And it's not fun for us. Jordan would just like scream out in pain and be inconsolable, and we couldn't really figure out why, but she'd be tugging on her ears a lot. And so that was the first thing we noticed. We're like, oh, that's kind of new. The first time I was like, oh, she just figured out she has ears. Touching her ears. And I thought it was more of I have ears. This is fun. I can touch them. But then when she kept doing it, and the first time was only one ear. So she was only touching the one ear.
Interesting. Yeah.
And so then I was like, and then when you Google it, it says that's a symptom of
one of the signs.
That.
Yeah.
And they can like kind of hold their neck to one side is another common one. Like the ear that's infected, they kind of put it towards their shoulder and will like scrunch up the neck and shoulder on one side because it hurts them and bothers them. Yeah, another one is she would cry anytime we tried to lay her down. For Jordan, she also would get, depending on how bad the ear infection was, she gets really off balance. And so she would be walking and we'd be like, we'd think she was just more clumsy. And we were like, that's weird. Like she normally doesn't, just walk into a wall. She can walk down a hallway fine. So those are some of the things that we've noticed, some of the numerous times we've had them. So things to look out for. But usually the antibiotics did help within like 24 to 48 hours. And the regular antibiotics she got tasted great. So it was easy.
They smelled really good, the ones that Henry had. I was like, they're bubble gum. I was like, I want to eat these.
They were like, Jordan loved taking it. So I was like, thank goodness, because that's another horror story of kids being sick, is trying to give them medicine.
That's rough. I was going to say, when you were talking about the signs that you noticed, because I had chronic ear infections as a kid, and I also had the tubes put in a few times and my adenoids removed, a whole thing. My mom later, like after I was a couple years old, she started realizing like behavioral things I would do when I had ear infections. And she said for the few days before, like later she realized, like looking back, that I would become like very irritable. I would stop listening. And like, she doesn't think it was actually like my hearing was affected. She just like, she's like, you were just a different child for those few days leading up to it.
Hmm.
And once I started to recognize those, then they could be treated earlier. The thing that I do know with ear infections is they can come on so quickly that like your child can just be like, you know, have a little bit of a fever and you're like in that, oh, is this a teething? Is this a cold? Like what's going on here? And then in the middle of the night, bam, screaming, inconsolable. So if you think your child might have an ear infection, the way to find out is you need to take them to either urgent care, your doctor, the hospital, even if it's the middle of the night and you're really struggling, and they look in the ear. Do I do the face again?
Yeah, a really cool face.
They look in the ear, and then from that they can see the actual inner ear and the eardrum, see if it looks infected, if it's pussy.
And if you think it, don't wait. Like there's no point in waiting a week to see. It's good to get in. If you suspect that it might be an ear infection, it's good to go in right away. Every time that I've kind of been like humming and hawing, should I bring her in? Should I not? Every time we've gone in, my husband's always like, oh, your mom instinct was right. Like she has an ear infection. And I don't know if there's the mom gut instinct or not, or whether or not that's true. I don't know. Every time I've kind of like, that's weird. And she's touching her ear. She's miserable. Like there's something going on. I need to take her in. And I kind of get this like, no, we need to go to urgent care or a clinic or something. And every time I've been right. So my husband's like, you're 5 for 5 for ear infections. Like you've always, you know, guessed them correctly. So you know your child best. If you think something is wrong, could be an infection, bring them to a doctor.
And I was just looking it up here on the CDC website about infections, ear infections and antibiotics, because that's always a common, like whether or not to give antibiotics is always a big conversation. So the CDC on their site, it's saying that if it's a middle ear infection, your body can often fight it off on its own. However, severe middle ear infections or ones lasting longer than 2 or 3 days need antibiotics.
I guess it depends on how long they have had symptoms for. Like when you go in and you say they've had a fever for 3 days, they'll probably be like, okay, well, antibiotics right away.
And the other things that the CDC recommends when to see the doctor, if your child has a fever of 102.2 Fahrenheit or 39 degrees Celsius or higher, if there's pus discharge or fluid coming from the ear, if they're having worsening symptoms, or if they have symptoms of a middle ear infection that lasts for more than 2 or 3 days, or hearing loss. But then the causes of the ear infection, we talked about before with the respiratory infections, it can be bacterial or viral. So bacterial, there's a few different bacteria that are common that can cause the middle ear infection. And then also if they have a virus, like a cold can also cause a middle ear infection. So that just adds more layers into, do they need antibiotics? Should I seek treatment? It's very complicated.
It is. So I think it does come down to like trusting your gut a little bit. And we'll get into some of the things that help, but having people that you can talk to and go to for advice is very beneficial to kind of, sometimes you just need to vent and get everything out. And then you'll have the answer. Like you'll answer yourself. You know what I mean? Once you start getting all the information out, you'll be listing things and you'll be like, yeah, okay, no, this is silly. We do need to go.
Sometimes you need a fresh set of eyes as well. Like when you're telling somebody else all of the symptoms and things that are happening, you realize how bad it is. You don't realize how sick your child is because you're living it. And then as soon as you either tell somebody, they recognize it, or you see it because you've gone out from the outside and watched your life from up above. And you're like, holy cow, they're very sick. Let's get them treated.
The next one is probably worse than the ear infections for us is hand, foot, and mouth disease. And Jordan was the lucky recipient from, it was her daycare Christmas present this year, was to get hand, foot, and mouth disease.
That's so nice of them.
And so just a little definition here so you guys know what it is if you've never heard of it. It's an illness that causes sores or blisters in mouth, hands, and feet. Sometimes it can be all over their body. It doesn't have to be only their hands, feet, and mouth, but it does have to be in at least one of those places. So if there's like an outbreak of sores all over their body, but it's not on the palms of their hands, not on the sores of their feet, and not in their mouth, it's not hand, foot, and mouth. Like, so it can be everywhere, but it has to at least be those places.
Got it.
It doesn't normally, like none of the bumps are painful except when they go in the mouth. So when it says hand, foot, and mouth, it means around the mouth, but also inside the mouth, they can get sores. And then it gets hard to eat, swallowing, and it's almost like a strep throat in that. Like they don't want to eat or drink or have to swallow anything because they can be painful. Jordan didn't want to brush her teeth, but typically it starts as just they have a fever for a few days, and it's kind of one of those unexplained fevers. You don't know what's going on. And then after 2 to 3 days of a fever, they might start getting that sore throat, or you're going to start seeing the red marks everywhere. In our experience, it was about 24 hours from like the first mark and having a fever and not feeling well. And then she had it everywhere. So we got it all over. There's really nowhere that didn't have any marks on her. Our doctor said that we won for the worst case that she had ever seen for hand, foot, and mouth disease.
Gosh.
So we're like, oh yeah. And there's my husband was like, we didn't raise a loser. And he was just trying to make light of the situation because it was not fun.
Jordan goes big. She doesn't mess around.
Why not? And there are some complications that can happen from it. So it's not super uncomfortable for them unless they get it in their mouth. And then it can be really hard. Jordan only took a bottle and would only drink formula, wouldn't eat food. It looks really bad and it's highly contagious. So you can't go out anywhere. Parents normally are immune to it. There is a slight chance that you could get it. So you do have to have good hygiene at home. And you have to like bleach clean all of the toys because you don't want them to get it again, or if you have other siblings in the house. So we had like a bleach cleaning party. I think it was Christmas Eve or the night before that. We just like laid out everything. My husband and I had bowls and rags and bleach and all these cleaners. And we had a little line and we had to clean everything. It's a lot and you're just kind of stuck at home because it's so contagious to other people. We called our doctor's office and they didn't even want us to go into our doctor's office because it's just so contagious to other kids. It's a tricky one. And then if you have to quarantine at home, that's no fun for anyone either.
That also explains why it spreads in daycares and schools so easily, is that it's so contagious and you can't stop kids from putting things in their mouth and sharing it. And even if you do clean toys every day, they wash their hands before eating.
And now she is losing some nails and she's losing skin on her fingers and toes. And that's like a less common. A couple weeks after you've hand, foot, and mouth, this is a less common occurrence, but it is linked to it. So like just more fun.
That's so interesting.
Yeah, it's just really common outbreak. It's one of the most common outbreaks in daycares. Even when we were at the hospital, she had some kind of weird complications. And because it was so bad, it didn't present very typically. And in the hospital, they told us to like sit in one place and not touch anything. And we're like, cool, with the 1-year-old, we'll just keep her in one spot.
Yeah.
And they're like, we know, like, do your best. But we're like, even in the hospital, when everyone is sick and has all these things, they were like, please don't touch anything and sit in one spot.
Stay away from us.
So hand, foot, and mouth, people get very, it's like it triggers a lot of people to be like, oh, like I had never worried about it beforehand. And then all of a sudden I experienced it. And now I get why people are so worried about it.
Those are a few of the illnesses that we've been through. Respiratory infections, ear infections, hand, foot, mouth. Henry also had, what we thought was really bad teething because he was drooling really bad. And then Dr. Google let us know that that is also a sign of a sore throat. And I was like, I would have never thought about that, but it hurts to swallow. So instead of swallowing, they're just kind of like letting it all drip out. So Henry had a sore throat. We took him to the urgent care clinic because I didn't know it was his throat. I actually thought it was an ear infection because he was just acting very unusual for him. He was very unsettled. So when we went there, they ended up doing a swab for strep throat. But in kids under the age of 2, strep throat is actually very rare, which I didn't know. And they said likely it's just viral, like a viral tonsillitis. And then he had some redness in his ears, like we mentioned before. Something that did happen from this was that, it wasn't even this time, actually.
No, it wasn't. I was going to say, I think this is a different, this was just he got sent home from daycare. He wasn't feeling well.
Okay, so, I'll keep that in about the strep throat. If they have some sort of swelling in their throat, if they're under 2, it's most likely viral and not strep throat, but you can still go in and they can get swabbed. Another time that Henry was sick, now that I'm thinking about it, it was before that. He got sent home from daycare with a fever and we were giving Advil Tylenol, around the clock, keeping him comfy. And then the next day he still had a fever. It wasn't super, super high, but it was, I don't know, like 10, maybe it was pretty high. It was like 38, which is what, like 101 or
daycare.
Something?
I remember at daycare, you said it was over 39.
Really high at daycare.
Like it was really high. And you're like, did they take it right? Because you were like, that's quite, so he did have quite a high fever for sure.
But then we'd been keeping it controlled. I think it was like 104. And I was like, that's like 40. I was like, there's no way, but maybe it was. Anyways, the following day I was at home with him. He was still quite warm and still had a fever. So we were still giving him the meds. And then he just started acting really funny. We think he had a febrile seizure, which they sound really scary, but they're seizures that are triggered by a fever and they're not they're not epilepsy because they're not the same. Febrile seizures, we know the trigger, and the trigger is the fever, and it doesn't mean you have epilepsy. And they're actually quite common in children, and they're not dangerous, which to me blows my mind because they sound so scary. I had known about them. Like, I remember learning about them in nursing school, but I'd never seen one. And obviously when it's your own child, it's terrifying. So I think I actually missed the actual seizure. I noticed like the after effects, because he was like clinging to me. He would not let go. He was just being very uncharacteristic for him. So I remember calling Jeff, my husband, and just saying, okay, don't panic, but I think I'm going to call 911 because
you don't panic or anything
is happening. And the thing that actually ended up getting me was that his lips kind of started looking blue. And he was breathing fine. So I'm like doing a little nursing assessment on him, like counting his respirates and looking at him. I'm like, he looks fine, but his lips look blue. So I think he might have had a seizure. So anyways, I hung up and called 911, which may have been overkill. I probably could have just driven him to the hospital, but you know, it's your child. You panic. But yeah, once we were there, they taught us a little bit more about febrile seizures and how they're actually not that concerning. And my concern was, well, like, what if he has one during night, like when he's sleeping? And apparently it's quite common that if they are going to get them, that they can have them at night, and it's okay. And I was like, oh, all right. So that's life.
But they sound frightening. Like that's why it's so
terrifying.
Important that we talk about it. And other friends of ours, their children have experienced this too. So it's common enough that in our little mom friend group,
definitely
a couple kids have had this so far in their year and a bit of life. So it definitely happens, and it's good to know what it is so that if you know, you can like identify and get help a little bit less chaotically than if you had no idea what it was and it was you completely were blindsided by it.
And also knowing that they do happen and that they're typically not concerning, so that like it doesn't mean they have epilepsy. Here from HealthLink BC, they're most common between ages 6 months and 5 years. 1 in 25 children will have one during childhood, and they're more likely if somebody they're related to has had one. So Henry's cousin had them when she was younger. So we do have like a small genetic link there. So there's a chance. Yeah. But for us, we don't even know. And the doctor said, let's just treat it as if it is one. So he's at a higher risk of having it again. So you just know for next time that's what happened. And I'm like, okay, there's that. But I'm glad that I shared about it on our Instagram, because a couple of weeks later, one of our friends, they actually saw the seizure happening in their child, and then they knew what it was. They ended up going into the hospital, and I'm sure it was still very scary, but maybe a little bit less, knowing that they're common and that they're not like life-threatening. And
but she had mentioned she was so happy that we had shared it because she felt like a little bit more knowledgeable and okay about it going in, because she was like, no, like you had just mentioned it. It was very quick after you had shared about Henry's experience that this had happened. And she messaged. So she actually took a video of it because she had the wherewithal, because she was like, this is weird. What is happening? No one's going to believe me. That she was just like, no one's going to believe that this happened. And what if I need to show a doctor? So she videoed it, which is actually a smart thing to do. So the doctor could actually see it and was like, yes, that looks like a febrile seizure, right? But that's a very, very scary one.
The actual seizure is very scary to see, but
yes, that's what I mean.
Actually is not. Yeah.
Like as a mom, that's a really scary one to see your child go through. Ear infections, like they're grumpy, but they're not. There's something just about the word seizures that just seem.
And it looks very scary. I know my sister-in-law was telling me when her daughter had her the first time that like her eyes rolled to the back of her head, and she was like, I thought she was dying because I didn't know what it was. And
yeah, I've had experience with it where like almost the entire baby went blue. Like it was a really, really severe febrile seizure. It wasn't concerning. And I remember going to the hospital and the doctor was just like, oh yeah, this is a febrile seizure. And I was like, the baby's blue. Like for me, I was like, I didn't have kids. And I'm like, you're telling me this blue baby is just having something common? And he was like, yeah. And I was like, why aren't you stressed about this? Like, and he was so calm and cool about it. I was like, okay, this is a thing. Like this happens. So it happens.
I mean, still scary.
Definitely scary. But that's an overall of kids' illness. It is really hard because it's a guessing game. What is going on? Is it just teething? Like for teething, you don't necessarily, like you're not going to seek medical care for the most part. Like it's just something you have to deal with at home. But how do you make the difference? Like you can't see those teeth right away. And for Jordan, it's probably like a good week almost before you see the tooth that she is miserable. It's online. If you Google it, they'll say, oh, like a day or two, they might be, not happy. But for her, it was like days, like definitely more than 2 or 3. I'd say closer to a week. before we even saw any little bit of white or tooth sticking out. For a week, we're like, what is going on? This topic is
we could go on forever and ever and ever. So we are going to end this episode here. We'll continue next week where we discuss funny things that happen with baby skin, because we both experienced some funny things. So don't forget to say something friendly to yourself. The mom that we think it's the most important for you to be friendly to is yourself, your inner mom. Say something friendly to her. She needs a hug. She needs some kind words. And have a great mom day. And we'll catch you next week. Bye now.